Good evening, and thank you for coming to this session. We had a 1 month of break, but very nice of you to take time. There's a lot of competing Zoom meetings and meetings where you are, but I think more important, health is wealth. So tonight we are going to start with understanding the causes of diarrhea and the different type of diarrhea and what remedies and what you can do to help yourself. So please, if you have any question, put it onto the chat as you go along so that you can remember. Now,
okay, good evening, everyone. Tonight's topic is dealing with diarrhea. Diarrhea, because diarrhea is a very common problem for all of us. So, in some cases, it actually, especially for a vulnerable group like children, it could be a life-threatening issue on diarrhea, right? Now, diarrhea cover both acute and chronic diarrhea. And basically, the causes of diarrhea are numerous. And I will try to cover as much as possible. And just remember a simple principle. There's no one size-fits-all solution for diarrhea, right? In fact, if you can diagnose your diarrhea and identify the cause of diarrhea itself, very often there is a specific remedy that can help you with the diarrhea itself, right? Okay, now let's start with what is the definition of diarrhea. Diarrhea means actually passing loose or watery stool more than 3 times per day, right? And you can sort of further divided into 3 subclass. Acute diarrhea basically is usually lasts 1 to 2 days. It's a very short, but the flare-up is very fast. Symptoms are quite severe in comparison, right? Then persistent diarrhea basically is diarrhea that lasts 2 to 4 weeks. And chronic diarrhea usually lasts more than 4 weeks. For diarrhea, what is the main risk? The main risk basically is dehydration and nutrient loss, right? So dehydration is the main risk for acute diarrhea, right? Because it can lead to complication and life-threatening situation. Whereas the main risk for chronic diarrhea basically is nutrient loss. You will actually resulting in loss of quality and basically in loss of actually our mobility and mobility. Okay, now let's look at some of the myths about diarrhea. Okay, so when you have a diarrhea, very often you will hear some of the people tell you to stop off.
So everyone,
this is wrong. Basically, rehydration is essential for diarrhea. So let's get it right for first. The very important that when you have a diarrhea, rehydration is essential. But the type of dehydration you take is important itself, right? Another means is actually antibiotics cure all. Actually, this is also false because most of the diarrhea are not cannot be dealt with antibiotics. Only the bacteria types of diarrhea, right, are actually can be dealt with antibiotics. In fact, you will know that you will see that down in my presentation further, you see that most of the actual remedies are not based on antibiotics at all. Right? Now, the third means avoid food completely. This is also false, right? While you have diarrhea, your body will lose fluid and nutrients, but you still need to take intake. So therefore, small frequent meals are usually encouraged, and you will learn how to actually handle meal, take the meal and choose the right types of meal to take during when you are having diarrhea. Okay, let's look at some of the global impact of diarrhea. So the reality is that, as I mentioned, most of the case of diarrhea for adults are self-limiting. They are not of concern. But for the children itself, actually diarrhea is the 3rd leading cause of death in children under 5. Right? So it's a very serious concern for children, right? And it contributes to malnutrition and dehydration. And it's the leading cause of malnutrition in children under 5 years old. You can see from here that the cause of child mortality itself, apart from pneumonia, actually diarrhea is actually the 2nd highest mortality rate of children, right? So therefore, it's actually diarrhea for children is a very dangerous event. Okay, What are the causes of diarrhea? Right, broadly, you can see from here that actually the causes of diarrhea, you can actually divide it in two groups. One is infectious origin, and the others is actually non-infectious. So infectious diarrhea can be caused by virus, can be caused by bacteria, can be caused by parasite. And these are generally the common example of infectious diarrhea. Non-infectious diarrhea are basically can be caused by inflammatory diseases like ulcerative colitis itself, and or disorder of gut-brain interaction, which is actually the common known diarrhea that we call it functional diarrhea, or very common types of uh, what they call diarrhea that are actually related to irritable bowel syndrome. So then the non-infectious diarrhea can be due to our food intolerance, right? We will talk about lactose intolerance. We'll talk about celiac disease later. Right? Diarrhea can be also caused by medication side effects. So therefore, the medication that you take itself, right, will cause the gut dysbiosis, which means that the bacteria overgrow in the gut. At the same time, also can cause bile acid malabsorption, resulting in diarrhea itself. And also, of course, our endocrine and metabolic causes like hyperthyroidism and diabetic patient also can actually have symptoms of diarrhea. Okay, now let's look at the causes of diarrhea. There's actually acute diarrhea. So when we talk about diarrhea, basically we basically want to make sure that we identify whether it's acute or chronic. Acute diarrhea itself, the causes are mainly infectious origin. You can see from here, right? Viral infection like rotavirus and norovirus itself actually account for about 30 to 50% of unvaccinated population what diarrhea. Bacteria like E. coli, Shigella account for 20 to 40% of moderate severe episode. And most of the bacteria diarrhea are actually food origin. So we will talk about food poisoning shortly. Okay. Then we have diarrhea that caused by parasitic, and we also have diarrhea that caused by chemicals and toxin in organic itself. Now in here, we want to let you know that actually food poisoning is a foodborne disease itself. So one of the actually symptoms of a foodborne disease generally is also diarrhea itself. So food poisoning is the most common cause of acute diarrhea. Okay, now let's look at food poisoning, and in some of the means relating to food poisoning, right? Most of us think that your last meal is the one that you eat that make you sick when you got food poisoning. While this is not always the case, some bacteria take much longer to multiply and show their effects on your body. So it can be a food that you can eat a day earlier also, right? So the lengthens the period, the incubation period of bacteria are not necessarily short. They can be longer, 2 to 3 days itself. Now, another mean is that you can chew your food to tell if it was cooked properly. And this is not true. You should know that you cannot taste chicken to tell if it has cooked properly or not. So only temperature can tell you, and therefore the food is cooked properly or not, you have to use a thermometer, right? Then the third main is that the spoiled food smells and looks rotten. Well, that's true. You can smell and look rotten, but some food that's spoiled are still fresh looking. So therefore, this is not the sure way of just looking at the food itself, right? Bacteria are not visible to our eyes, all right? Then another one is washing your hands before eating will keep you safe. While it's commonly a good practice itself, but it's not keep you safe because the food poisoning can be originated from the source of the food. The preparer itself, the food source itself can be contaminated itself, right? So plastic chopping boards are more hygienic compared with wooden chopping board. But there's no evidence on this itself. Basically, there's no evidence that what types of chopping board are more hygienic. But most important is that you do not use the same chopping board for cooked and raw food. Basically, this is to ensure that there's no cross-contamination, right? So that is actually the better practice itself. There's no real difference between the plastic or wooden chopping board. Vegetarians are at low risk of food poisoning. That's not true. We all know. vegetable and fruits are also likely to cause food poisoning. So these are the food poisoning means. Right. So let's look at one of the most common causes of acute diarrhea, and this is actually what we commonly known as norovirus, which is the stomach flu. Stomach flu actually is the leading cause of acute diarrhea, gastroenteritis globally, right? And for children, it's actually it's a very dangerous disease, and I want to highlight that because that among acute diarrhea, I will highlight only these types of infectious origin itself, right? The symptoms are diarrhea, vomiting, nausea, and stomach pain. So it's not just diarrhea alone. Very often the symptoms have vomiting, nausea, and stomach pain come together, right? Now this is very important to get treatment. The problem is that this is a virus infection diarrhea, right? And therefore there's no approved treatment for the norovirus. So and it's because it's a virus, the transmission is also highly contagious itself. So therefore, the only way to prevent this stomach flu actually is that when you have it, right, you have to make sure that you do not isolate yourself and do not have contact with others itself. You have to wait till your symptoms are gone before you can actually start touching on preparing food for others, right? Now, if possible, do not share bathroom with others. Wash hand often, or at least 20 seconds with soap and water, right? And if you have any vomit or diarrhea, clean it up, and use what they call disinfectant to clean it up itself. So the only way you can prevent this stomach flu is actually prevent it from spreading, from contacting it, is keep your personal hygiene clean. Now, for acute diarrhea, all right, so there are 4 standard phases of home management. Most of us, when you have diarrhea, you manage ourselves. So it's important for us to understand that whenever you deal with diarrhea, you really have to understand that how to deal with it properly, right? So this is not something that I think allow us to think that diarrhea means that it can go away by itself. First, there are 4 steps that I will recommend. First is to know how to actually immediately rehydrate yourself. We call it oral rehydration therapy, right? The second step is that actually know what are the food to eat, right? The third actually is that you must learn how to screen for red flags that is actually need medical attention instead of self-management. And the fourth is that how to choose the right over-the-counter medication for the diarrhea you have itself. All right, so let's look at it itself. The first step of acute diarrhea management strategy actually is the rehydration strategy. Now, hydration is the single most important factor in all diarrhea, right? So it's very important. Unfortunately, the standard water is not sufficient because it lacks the necessary salt to be absorbed effectively during an active infection. And that's why that drinking water alone is no good, right? So that's why a lot of people say don't drink when you have diarrhea. Not true, right? But you don't drink plain, pure water, right? What are the preferred fluid? Oral dehydration solution is actually the cornerstone of the treatment. Now, how to prepare a home oral dehydration solution? 1 liter of water, 6 teaspoons of sugar plus half teaspoon of salt. This is a standard recommendation for actually in regions whereby they cannot get oral dehydrated salt readily. And in fact, in a poor country, in country whereby they are lack of what I call the health support, right? Very often the healthcare provider will know how to prepare the homemade oral dehydrated salt solution. All right. So this is a formulation that you all can take in and prepare yourself, right? Alternative that is coconut water, right? You can also actually take sport drink. Now, for those who are diabetic, then you probably should not choose the sweet sport drink itself. But sport drink have all the minerals that you need. So sport drink is a good alternative oral rehydrating fluid as well. And of course, you can drink broths and clean soup, chicken broths and vegetable broths and so on. Now, when to take is also very important. 1-for-1 rule. Drink at least 1 cup of oral rehydrated solution for every loose bowel movement you have. Right, that is the standard guideline. That means whenever you have a bowel movement, right, drink 1 cup of the solution. right? Drink 1 cup of water, drink 1 cup of coconut water or whatever. 1-for-1 rule. Remember that when you are having acute diarrhea. Now, what are the food that you can eat itself, right? So try to resume appropriate eating as soon as possible, usually between half a day to 1 day. Between 1 day, you can try to eat something already, right? So what are the things that you can eat itself? First of all, a strict bread diet for the first 2 days itself. Basically, what are the bread diet? Bread diet basically are porridge, banana, toast, apple crust. So therefore, these are actually the recommended diet for first 2 days itself, right? Then after that itself, you might able to choose to take some what we call low-fat protein like fish, tofu, cooked eggs itself. You can also take digestible fruits and vegetables like carrot, pumpkin, banana. All right. You can take probiotic food, yogurt, miso, soap, and also of course you can take rice porridge, oatmeal, and crackers. So these are suitable diet for people who are undergoing acute diarrhea. Now, what are the food you should avoid when you're having acute diarrhea? Right? Spicy food, fried and fatty food, sugary food and beverages, right? High fiber food. This is something that I want to highlight a bit. A lot of people think that the high fiber food is usually healthy, but it's not suitable for people who are having diarrhea. So avoid high fiber food. Dairy product should be avoided during the diarrhea period, and also caffeinated drinks like coffee, tea, and alcohol. Okay. Now, the third phase is that to determine whether the diarrhea needs to have medical attention. Now, this is important. Also, the basic knowledge of this itself. Whoever have diarrhea, right? You need to consult a doctor immediately if you experience 10 or more bowel movement in a day. That means if your diarrhea is so intense that you have more than 10 bowel movement a day, or you have persisting symptom that diarrhea doesn't getting better after 2 days of diarrhea. So these are the first signs that you should seek medical attention. Do not self-treat. Other than that, other warning signs are actually bloody or black stool, severe dehydration. This is particularly important because that when you have people that having sunken eyes, dizziness itself, although that you might have other things, right? That is also show sign that because the person might not be hydrating enough. That means they do not drink enough fluid during the diarrhea. And when you lost enough water in there, you have a symptom of sunken eyes itself. So particularly for older people, it's very difficult to distinguish between old people's eye and as well as a sunken eye. So you need to be more careful for older people, essentially, on this symptom. Acute abdominal pain, right, and a high fever. So any of these symptoms itself, I think, will require immediate doctor attention. Don't self-treat. All right. Then what are the OTC pharmacological management, what they call option we have? That means what are medicine we can choose to take itself. So in here, I list 4 very common off-the-shelf option, right? First, obviously, is actually anti-motility, which is actually the doctor's commonly prescribed medication to you, right? The main mechanism of this medicine actually is to slow down the gut movement to allow the water reabsorption. Basically, it's slowing down. So therefore, the speed of this medication actually is very fast. Usually within an hour, you will see the effect. But it's not suitable for bloody stool or fever cases, people with fever. So this is very important to understand that there is a concern that if you have a bloody stool or you are having fever, then you should not actually take the anti-motility medicine. Now, they are very common and very often I think there's a safer option for it itself that if you have a diarrhea, you actually can use absorbent. Absorbent, a good absorbent is active charcoal, right? Active charcoal, the speed of action is quite fast, 1 to 2 hours. And basically the mechanism of it is that it binds toxin irritants. So it's very effective for active charcoal for toxin, food poisoning in terms of chemical poisoning, and so on. But also actually the charcoal can absorb bacteria. So it actually can help in relieve the symptom itself, right? So, but then when you are taking active charcoal, be careful, because active charcoal, because it's a very powerful absorbent, it can interfere with other medication that you take itself. So you need to space it, or you need to be careful about combining with any medication. All right. Then there's a very common TCM medication we call po chai pill. For those who are familiar, you know that it's very common in the olden days. Whenever you have a problem, you take the po chai pills itself. Right? The mechanism are not clear, but we know that you actually, because of the formulation, you actually have multiple mechanisms itself, right? But the speed of action also, the po-chai pill are normally not fast. It actually takes between a day. Between a day after taking a po-chai pill, you see the effects itself, right? But po-chai pill are not suitable for intestinal infection disease. That means that if you identify that your diarrhea is caused by infection diseases itself, by bacteria or virus itself, po-chai pill might not be very effective itself. Okay. Then of course, then you have a common thing that some of people say diarrhea, you take probiotic. But reality is that probiotics are not so much suitable for acute diarrhea because of its speed of action is days to weeks to effect. Right. So I will not talk about it as a antidote or immediate medication used for acute diarrhea. Probiotic is often used very effective, in fact, for chronic diarrhea itself, right? So this option for acute diarrhea normally are not suitable, not effective compared with absorbent, the active charcoal or the po-chai pill itself, all right? Now, as to the means that you should take antibiotic when you have diarrhea, that's not true. In fact, you can see from here that antibiotics are not recommended for most acute diarrhea cases because most of the acute diarrhea infection origin are not bacterial pathogens, right? So it's only applicable for when you confirm that the diarrhea is caused by bacteria, then only antibiotics is effective itself. So generally, antibiotics are not used for acute diarrhea unless we identify that the source is actually due to bacteria origin. All right, what is the practical self-care measure? Right. Rest at home, avoid strenuous activities, all right, until your stools are improving, hydration is adequate, right? Rest, practice strict hand hygiene, you all know, keep yourself clean, all right, and dry, clean, and then stay off work of handling food, caring for vulnerable people. Very important. A lot of our infection origin is infectious origin. So therefore, you want to make sure that you don't spread to others as well. Right. High risk special population. As I mentioned, for acute diarrhea, there's 3 groups of population that you need to pay attention because that can be life-threatening. So the first one is children, right? So when you have diarrhea for children, you don't really want to consider self-treat, then see a doctor. Regardless, see a doctor, all right? Same thing for elderly. Elderly, when you have a diarrhea, is also equally dangerous, and the complication can come very fast itself. So you need to monitor the hydration closely. As I mentioned, it's very challenging to differentiate between old people's face with sunken eyeball itself. But very often that is the first sign of hydration, and the complication can come around outbreak. So very important to monitor for old people whenever they have a diarrhea. And of course, for those who are immunocompromised itself. Okay, now let's look at the chronic diarrhea. So chronic diarrhea actually is very prevalent, but if you look at it itself, in the general population, it's about 4 to 5%. But chronic diarrhea is very prevalent for the old people, right? So nearly 40% of the patients of chronic diarrhea are above 60 years old, which means that this is the most common types of diarrhea for older people. And if you look at it itself, what are the causes? It can be broadly divided into about 6 categories, right? First, functional diarrhea, right? This functional diarrhea including irritable bowel syndrome, right, which account for about 9 to 23% in the population. And in fact, in primary care, it actually account for 50 to 60%. Right? So this is one of the most common cause of diarrhea is the functional diarrhea. We'll talk about this diarrhea shortly. Right? Organic diarrhea caused by organic diarrhea, which is diseases itself. Right? So this account for about 10 to 20%. Right? Now, and diarrhea that caused due to malabsorption itself, right? Bacterial overgrowth, pancreatic problem, right? This also account to 15 to 20% in the elderly. Then we have inflammatory caused diarrhea, like inflammatory bowel diseases and infectious diseases, like we just mentioned, right? So this account for about 30% of an infection caused diarrhea. Especially, it's more than 30% in low-income group. So then we have other like food that cause the diarrhea. Food can be due to laxative medicines, all right? Lactose intolerance, endocrine problem. So this also account for 5 to 15%. So you can look at it itself, there's so many causes of diarrhea, right? And therefore, we will try to cover the majority types of diarrhea as much as possible, because I can tell you that for old people, some of us probably have multiple types of diarrhea together as well. So it's very challenging for us to deal with diarrhea, because it doesn't go away if we don't know how to deal with it. But although it's not life-threatening, but it is actually it will cause a lot of what they call malnutrition problem. Right. So let's look at the classification of diarrhea itself. Now, in broad sense, if you look at the diarrhea, you look at the classification. This type classification system is actually it's easy for the layman. You choose it is because it's easy for the layman to identify yourself what type of diarrhea you're having, and we can actually broadly break into 3 types. All right. One is watery. What 3 types of diarrhea itself you will know, right? Generally, it actually can be caused by 2 to 3 types of other watery function. We can actually divide the watery to osmotic, secretory, or functional itself. We'll discuss this separately later, right? Then another types of diarrhea you can differentiate is the fatty one. The fatty diarrhea usually is foul smelling. Stool is bulky and greasy. So if you look at the diarrhea itself, your stool itself, you were able to differentiate whether the diarrhea is watery or fatty itself. And there's a third type of diarrhea, usually is inflammatory. In this case, actually, you will very find that you find blood in it, you find mucus in it itself. So these are actually a more serious types of diarrhea itself. So you, first of all, you need to differentiate the general types of diarrhea. When you have a diarrhea, whether it's watery, whether it's fatty or inflammatory. But right now, as you can see from here, diarrhea management is not one size fits all at all, because a lot of management solution depends on the mechanism that's dealing with it. Okay, now first, the guideline for self-diagnosis. I think everyone knows how to differentiate when you have diarrhea, right? So I just give you a just quick rundown. So you can see from here that the standard B2 chart is the reference for actually defining whether you are having a diarrhea or you are constipated, right? So you can see that when the stool shape is this form, 3 and 4, these are considered healthy. Now, when your stool is actually of this type and watery, more mushy stool, these are actually, you know, it's diarrhea. And of course, when it's constipated, you know what it looks like, all right? So anyway, doesn't matter. Don't worry about secretory or osmotic itself, because it's going to be quite challenging for you from the watery side itself. Basically, we all know when we have diarrhea. Okay, now, this is an important chart, although this chart looks a bit complicated, but this chart will give you the reference as to the causes of the diarrhea, right? And I will attempt in putting here in this table actually is the types of typical characteristics of this type of diarrhea. So you can, based on this type of typical characteristics, you can diagnose and to some extent narrow down the causes of your diarrhea, right? So this table is a very important guide. It might look very complex, but it's important because you will know, as you can see subsequently, right? All the solution depends on whether you can identify what is the cause, right? So therefore, what are the stool types? The stool type itself, as I say, there are 3 watery types of stool types itself. The first one, osmotic stool types, are actually the stool volume decreases during fasting itself. So this, when you have a stool volume decreases when you fast, that means you don't eat, and you have a watery types of diarrhea itself, right? The common causes of this type of diarrhea is lactose intolerance, right? Very common is lactose intolerance. It can be due to magnesium laxative, antacid that overeating, right? Or sorbitol, which is too much of sugar, the artificial sweetener in digestion, right? Now, when you have watery diarrhea, that actually where we very large stool volume, a lot of water in there and persists despite fasting itself, then chances are it could be due to your E. coli bacterial infection diarrhea, right? Or can be due to a bile acid malabsorption diarrhea itself, right? Now, when you have a watery diarrhea, that's actually functional. That means that there's no symptoms of actually having the problem at night, right? And it's stress related. Often it's just stress related, have no other causes itself. Then this is most likely that is due to irritable bowel syndrome or what we call the functional diarrhea. And this is actually the most common type of diarrhea most of the old people have experienced for us. So most of the time, I'll put it that way, most of the time, unless you are Asian, that when you have watery diarrhea, right, chances are that you either having a combination of lactose intolerance or you're having functional diarrhea. This is generally my experience in that itself. But when your stool volume is very large and persists despite your fasting, then you have to be careful. It could be a bacterial infection types of diarrhea itself. Now, fatty diarrhea is easier to distinguish because it's actually a result of malabsorption. So you can see from there that the fatty diarrhea are smelling stool, oily stool itself. Now, these are signs of actually fatty diarrhea. So in this case, actually, the diarrhea persists despite fasting, but you have deficiency of vitamin D, K, and B12 sign. So you can actually go and search on the internet what are the signs of deficiency of YK12, but never mind. But generally, these types of diarrhea, the causes are the bacterial overgrowth, short bowel, and celiac diseases itself. Very often, it's actually the dysbiosis, which means that your gut bacteria imbalance, which is actually the SIBO, small intestine bacteria overgrowth. This is the most common type of cause of fatty diarrhea. Then, of course, you have diarrhea, have present of blood, pools in the stool, and you have fever and urgency, all this itself. Generally, these are actually disease caused, and in fact, you should not deal with it yourself. You should actually go for medical treatment. So basically, we should concentrate on watery diarrhea and fatty diarrhea itself, and the common cause are there. Right, so let's talk about the most common chronic diarrhea, which is a functional diarrhea. What is a functional diarrhea? Functional diarrhea and also the what you call irritable bowel syndrome, which we are familiar with itself, are the two major bowel disorder characterized by diarrhea, right? And this is due to what? The mechanism of this problem is actually due to the problem connection between the brain and the digestive system. So that means there is a communication problem in there, and therefore resulting that your diarrhea itself, right? So because this is actually, that's why some of the trigger are actually can be the stress, can be a trigger, right? What are the distinguished symptoms of these types of diarrhea? First of all, abdominal pain relief after defecation, right? Alternating diarrhea and constipation. So you might have diarrhea, you also can have constipation. This is because of the brain triggering your bowel movement in there, right? So bloating and excessive gas, less common, right? And there is no significant weight loss or fever. Very important. This is a very distinctive sign. That means when you have this symptom and you do not have significant weight loss or fever. But if you have weight loss and fever, that's another issue altogether, right? So the functional diarrhea itself, right? The prevalence are very common. You can see from there that IBS affects about 10 to 15% of the population, and IBS is more common women. This is more common woman problem. Okay, right? So what are the risk factors? So first of all, as I mentioned, because it's a brain gut disconnection. So psychologically, the stress, mental problem are one of the trigger, right? And you have a history of GI infection also can be a risk factor, right? And you have an altered gout microbiome, which means an imbalance in the gout bacteria, frequently observed in IBS syndrome, which means that if you have medication or you sometimes you have a wrong food in there, it can also cause a bacterial overgrowth. This can cause IBS, the symptom of IBS. Dietary food and food intolerance. So basically, if you eat food that's rich in a lot of sugary food, right, in fats and caffeine and alcohol also are common trigger for that. right? And you also, if you have a case of normal gout motility itself, right, in the intestine due to surgery or due to actually some medical condition, it also can lead to this itself, right? And the hormonal changes like menopause, pregnancy, or hormonal therapy may affect IBS itself. So these are the major factors. You can see from here that the functional diarrhea, the most common types of diarrhea we have is the risk factors are so many. So in fact, no wonder that it's actually very common for most of us. And in fact, this is very common for the older women, right? So what are the strategy for this type of diarrhea, right? So I'm going to make it very easy for everybody. First of all, the diarrhea type is watery, right? So therefore, what are the dietary strategy when you deal with this type of diet? First of all, a low food map diet, reducing fermentable all the saccharides food, right? I'll show you the detail of what are the food map diet types itself, and avoid the trigger, limit the caffeine, alcohol, artificial sweetener. Now, for nutritional support itself, first of all, for IBS itself, this type of diarrhea, soluble fiber. So Atomis selenium husk can be a very good supplementation, right? Probiotics, remember, and herbal adjuvant, you can use curcumin and berberine itself. This is not available in Atomis portfolio. But then I think the selenium husk and probiotics are the right nutritional support itself, right? Now, important IBS is actually nerve trigger, brain and gut dysfunction. And therefore, actually, you need to manage your stress and anxiety, right? Make sure you have enough sleep and have relaxation routines. And of course, for those who suffer from risk of having thyroid diseases itself, you need to actually review for thyroid or medical related causes itself. Okay, now, and it's important for me to show you this because subsequently, a lot of dietary solution itself might refer to low food map diet, right? Now, low food map diet means what? Basically, if you look at it itself, there are food or vegetable that is considered low food map, which means less fermentation, will cause less gassy, right? So what are the one? Actually, potato, eggplant, celery, green beans, pumpkin, carrot. These are low food map, right? What are the one that you should avoid? Garlic, green peas, mushroom, onion, cauliflower, asparagus, right? So you can differentiate. So I'm not going to go through it again, right? But you can actually later on get a download of the PDF file, and then you can do your own reference yourself. So even the fruits itself, kiwi fruit, mandarin, orange, basically the citrus-based food are suitable for low food map. But the sugary food, the fructose-rich food are not suitable. They are considered high food map food, okay? Right? And the dairy side, actually all the non-cow's milk, non-cow's milk itself are suitable, right? Lactose-free milk or cheese or almond milk itself or soya milk are good, right? Protein, basically eggs, tofu, plain cooked meats, and poultry seafood itself, right? Breads and cereals, oatmeal, rice, sourdough, all that are okay, right? Gluten-free products, okay? Sugary, sugar, sweetener, dark chocolate are okay. Maple syrup, okay, table sugar. And nuts and seeds, basically peanuts, pumpkin seeds, and all that, all right? And avoid cashew nuts, pistachio. So these are basically a reference for you. And when you talk about low food map diet itself, basically you have a list of food that you should avoid, a list of food that you actually need can be considered. All right. Now, for IBS itself, what are the complementary and alternative therapy? Here are these 4 items. Right? You can take it as a very good reference because they are very good, what they call backup study on that. There's a lot of results showing that they are very useful. Probiotic, vitamin D, curcumin, and berberine. Right? So all these 4 products are useful supplements when you are suffering from IBS. Okay. Now, for chronic diarrhea, right, there is a big segment of chronic diarrhea due to food intolerance. So we put food intolerance diet. If you look at it itself, food intolerance affects 15 to 20% population globally. In fact, a lot of us actually, the diarrhea is caused by our food problem, right? So main cause of food intolerance can be also subdivided in 3 subgroups. One, there's food intolerance that's caused by carbohydrate intolerance. So this is our common, most familiar lactose intolerance and fructose intolerance. We'll talk about this shortly. Then we have the protein intolerance. Protein intolerance actually are the gluten intolerance and cow's milk protein, right? So then we have a food chemical intolerance. Basically, this is saccharide sensitivity and histamine intolerance. So this is the lesser concern because the prevalent rates are lower. So I will not talk about this in this session itself. So the main one we'll talk about on the food intolerance caused diarrhea are the carbohydrate intolerance, which form the bulk majority of our food intolerance diarrhea problem, and also the protein intolerance. Okay, now let's look at the lactose intolerance, right? So this is a form of carbohydrates itself, right? So you can see from here that the deficiency of our lactase enzyme is actually the cause, right? So therefore, it's due to our enzyme in our body. It's deficient. And as this enzyme gets less and less in our body, then when we eat food that contains lactose, the carbohydrates itself, the body will actually reject it and you have diarrhea. Right? What are the symptoms? Diarrhea occurs shortly after consuming dairy. Very typical symptom. So the moment you drink a milk and you have a diarrhea, this is one of the telltale signs that you're having that itself. And some of them will have severe bloating, cramping, and excessive gas itself, right? Symptom resolve when avoiding lactose-containing food. Now, one of the very significant one is the diarrhea occurs shortly after consuming the dairy product, all right? Now, remember, these symptoms itself do not coincide with very loss of blood in stool. If you have this, it's a totally different issue. So there's a very interesting study I picked up, Malaysia study report, right? So Malaysia basically have a very high prevalent rates of actually lactose intolerance, and they try to see whether there's any difference between ethnic groups. So you can see from here that basically there are not much of big difference, although the Malay actually fare better, lactose deficiency lower lactose deficiency compared with Chinese and Indian. But Chinese and Indian are having a close to 90% means that most of the Asian, except for the Malay side, in fact, I will put it that way, even including the Malay itself, 80%, more than 80% of the Asian population are suffering from some form of lactose deficiency. Right. So the degree of lactose deficiency varies by people. So if you have a high lactose deficiency, then you will have lactose intolerance diarrhea, right? But some might not. Some might be able to tolerate a bit. Okay, right. Now, what is the dietary strategy for people who suffer from lactose intolerance? First, of course, I think that avoid all the dairy-free or dairy-free food, the dairy food, right? So basically, you have a dairy-free or low lactose food. So this is the first solution. Nothing to say, right? Because your lack of the enzyme, so avoid the food that containing lactose itself. Alternative is use the utilized plant-based milk, soybean milk, oat milk, and so on. What are the nutritional support? So this is where the supplementation play a more important role, right? First of all, you can actually supplement with a lactase enzyme supplement. So Atomy have a enzyme supplementation that contain lactase. So you can take that as a supplementation to increase your lactose tolerance itself, right? Probiotic, certain strain of probiotics which can help to improve the lactose digestion, and also calcium and vitamin D also is help to prevent deficiency with diarrhea. If you don't take dairy product, right, you need to supplement with calcium and vitamin D. And remember that. So this is not really take care of the diarrhea, but it's more of what they call complementing the lack of your diet, the diet deficiency in calcium and vitamin D. All right. Now, important, right? When you have this itself, also need to make sure that you do drink because you're having a diarrhea. So remember, as I say, the rules is very important, right? So when you take care of the diarrhea, make sure that you avoid the high sugary sport drink, right? Excessive sugar also can cause this type of diarrhea. So when you are drinking more drink, for instance, you're having a lactose intolerant diarrhea, please avoid sugary drink as well. Okay? Fructose intolerance and malabsorption. Now, this is actually due to the sugar. Sugar. That one is not sugar. That is due to milk, carbohydrate in the milk. So in this case, the fructose intolerance cell, right? What are the symptoms? The very distinguished symptom of this is bloating, gas. Although the diarrhea is still watery, abdominal pain, but the distinguished symptom is bloating and gas itself, right? And dose dependent. What it means that the more fructose you take in, the more severe the symptom, the less severe. So it's actually depending on the dose you take. So this is very important. And there's a very interesting study by Singapore. Right? Singapore's Ministry of Health said the Singaporean consume about 12 teaspoons. It's approximately 60 grams of sugar daily. It's actually quite high, but Singapore is, I think, is one of the high sugar intake country. So if you look at it itself, we over half of them from sugar sweetening beverages, from the beverage itself. Now in here, it's very important. In here you can see that there is a study suggests that up to 50% of the general population cannot completely absorb a 25 gram pure fructose load. That means that if you look at it itself, 50% of the population cannot absorb a 25 gram pure fructose load. And 60 grams of sugar itself, at least will have more than 25 grams of pure fructose sugar in there. So therefore, it means that the estimated prevalence rate of fructose intolerance in Singapore, for instance, for the adult itself, is actually 30 to 50% of adult. So it is very common. It all depends on where, but I think this study showed that in Singapore, in fact, more than 50%, about 50% of adults having this problem. So, okay. Now, what is the solution for fructose intolerance itself? Again, now, this is a very simplified table for everyone already, right? Your diarrhea type is watery, right? Now, the strategy is low food map or low fructose diet. Now, as you say, fructose diet means that all the food, sugary food, especially the apples, pears, and watermelon. These are sweet fruits and which have a very high fructose content itself. Honey, syrup, high fructose corn syrup, right? Fruit juice and dry fruits. These are all very high fructose food, should be avoided itself, right? So you should adopt a low food map diet and glucose co-indigestion, which means that if you consume glucose, the fructose, you probably can improve your absorption. Like table sugar may be better tolerated than pure fructose itself, right? Now, choose lower fructose fruit like banana, blueberries, strawberries, and so on, right? Now, the nutritional support side, again, all right? So first of all, probiotic, right? You, of course, as I mentioned, the low food map plan, you have probiotic and general micronutrient support, which means that basically for this case, general multivitamin will be recommended generally for the fructose intolerance diarrhea. Okay, now the third types of diarrhea that's caused by protein is called gluten intolerance. Okay, gluten intolerance actually is a disease, right? And you can subdivide it into two subclass. One actually is a non-celiac gluten sensitivity. Basically, it's actually the body immune response to the gluten or wheat component without autoimmune or allergic mechanism. But another one is actually a celiac disease, which basically is the autoimmune disorder response to gluten itself. Now, for most of us, for the general public, the non-celiac gluten sensitivity is more prevalent itself. And general symptom for gluten intolerance is that, first of all, right, bloating, abdominal pain, diarrhea, very common in a lot of cases itself. Extra intestinal symptoms are like fatigue, headache, brain fog, and joint pain. Now, these are something that commonly occur for people who suffer from gluten intolerance, not common for other types of diarrhea. So this is one of the ways for you to distinguish yourself, right? Now, occur between hours to days of gluten indigestion. It's not an easy diarrhea to actually diagnose itself, because this is actually a disease condition itself. And very often, I think that you will need probably medical attention to actually know how to actually diagnose and identify this problem. Now, if you are suffering from celiac diseases itself, right, one of the things that you can distinguish yourself is that the diarrhea is always a fatty diarrhea. So that is the only distinguished symptoms that you can have that that tell you that, okay, now is your diarrhea, is it due to celiac disease or related disease or gluten intolerance problem, right? So in this case, the dietary strategy is very straightforward. Very strict gluten-free diet, right? So you have to completely avoid wheat, barley, and rye. Okay. Then the nutritional support side will focus on the anti-inflammation food, right? And of course, any anti-inflammatory supplement is also helpful for this case. All right. So the correcting the deficiency of the malabsorption, right? You have to supplement yourself with actually the oil-soluble vitamin D, right? Then you also have to supplement with irons, calcium, zinc, magnesium, folate, and B12. So a multivitamin very often is also recommended. Okay, now another types of diarrhea that's caused by a small intestinal bacterial overgrowth. We short call it SIBO. This is actually very common when your bacteria in the intestine is actually over-colonized by fat bacteria cell, right? It's very prevalent in the IBS patient, right? In fact, it can be up to 80% in some IBS patient itself, right? So this, what's the problem? The problem is that the slow passage of the food going through your intestine, resulting in the breeding ground, causing the carbohydrate, the food to fermentation, so the bile salt deconjugation and mucosa damage itself. So and then resulting in malabsorption and diarrhea. So this is the mechanism that causing it itself. So basically, there is a fermentation of the food, right? Bile salt deconjugation means the bile salt reabsorption is affected itself, and a malabsorption resulting in malabsorption and because of the membrane damage. Okay, now what are the presentation of SIBO, right? The clinical presentation for SIBO actually can be, the distinguished one basically is a chronic diarrhea, it's a watery diarrhea again, right? But severe bloating and excessive gas is one of the very distinguished symptoms. It means in this type of diarrhea, very often it comes with bloating and excessive gas. This is a very distinctive symptom itself, right? Symptom will worse after eating the food nap, which means the fermented food. If you eat fermented food, the symptom will go out, get worse itself, right? Now, loss of appetite, nausea, abdominal pain, cramping, fatigue due to nutrient deficiency are additional symptoms of some of the people, right? Now, the problem with this is that it can cause complication. If you don't treat it itself, you can have malabsorption syndrome, which is actually in the long term, it causes a lot of other complications, right? You have vitamin deficiency, especially the oil-soluble vitamin of A, D, E, K, right? So therefore, it's very important that when you have this condition, right, you need to supplement with the oil-soluble vitamin itself, and you can cause weight loss, it can cause anemia due to malabsorption, all right? Okay, what are the risk factors for these types of diarrhea, which is actually caused by bacterial imbalance, overgrowth in your intestine? Aging is a problem, and therefore, as you age, our enzyme go down, our gastric acid go down, our ability to actually digestion go down, or motility slow down, right, in gastric, in our intestine, and therefore, this is one of the major risk factors. So it means that a lot of us, when you're getting old, you have a higher risk of having indigestion, diarrhea due to the bacterial overgrowth. Right. Another one is actually the medication. There's a lot of medication that can cause this because it actually disrupt the balance of your intestine bacteria. And like proton pump inhibitors, right? Antibiotics, metformins, and painkiller. Right. So these are very common. Metformin is a diabetic, right? This is actually the gastric reflux. PPI is the gastric reflux medication. So these are very common medication we take, and then in fact we very often sometimes concern the metformin and PPI long term. You have to take it for long term, and therefore you will result in your bacterial imbalance in there and resulting in having diarrhea. So you might have what they call the medicated trigger side effect of diarrhea due to medication. right? Now, other thing is that when you have surgery, you have gastric bypass, or you have other issue in the medical body, right? Then you also can cause this problem, right? Usually, this is due to a shortening of the intestine, due to surgery that cut short the intestine itself, right? The medical conditions are diabetic. Diabetic patient, about 20% of them will have this problem. Hypothyroidism, 20 to 30%, which means that these are the medical conditions that can also resulting in your what they call the this diarrhea due to the bacterial imbalance in the intestine. Okay, now the SIBO treatment, the table for SIBO treatment. First of all, the SIBO, the diarrhea types is watery, right? Now, the dietary strategy is low food map, right? Now, low food map alone is not enough, not enough. Very important actually is that in this case, you need to time your meal and portion control, because the issue is that your intestine is having a very slow motion to your passageway. So you do not want to eat too much, so that too much of food stuck in there and then causing fermentation. Because there's a lot of bacteria there that you can cause fermentation. So meal timing and portion control become a centerpiece in your dietary strategy for SIBO diarrhea. All right. Then on the nutritional support side, as I say, fat-soluble vitamins are important because your malabsorption resulting in all the fat-soluble vitamin loss deficiency. So you need to supplement with fat-soluble vitamin, B12 as well, right? And then also you actually see whether you can take zinc, L-glutamate and probiotic if you after actually any of the treatment itself. Okay, now another very common one is actually the bile acid malabsorption. Actually, this bile acid absorption is part of the trigger caused by the bacterial overgrowth that we said earlier, right? So what is the mechanism of this is that our body normally secrete the bile acid, right? The bile acid acts as a very important component in our digestion system, right? It tries to break down our fat-soluble nutrients itself. Now, the bile acid is not reabsorbed in the end of the small intestine completely, right? Normally, 95% of this bile acid is actually absorbed after it's excreted from your liver. Actually, at the end of this small intestine, 95% is reabsorbed. Only 5% go into your large intestine, right? Now, in this case, if your bile acid is not fully absorbed and it's a lot of the bile acid actually is run into the large intestine, you result in actually trigger water secretion. And because the bile acid is an acid, so therefore the large intestine will secrete water into there to flush out itself. So resulting in watery secretory diarrhea itself, right? So this is actually very well connected to actually the bacterial overgrowth problem. Now you look at it itself, the BAM, the bile acid malabsorption actually, what are the symptoms? Basically, chronic watery diarrhea, very urgent, difficult to hold. This is a typical symptom for these types of diarrhea. The increased bowel frequency, especially post-meal. Now, the problem is that these always have a lot of overlap with the bacterial overgrowth symptoms of diarrhea. But very common for old people is that when you are having urgent, difficult to hold watery diarrhea very often, and then whenever post-meal, you will always have a higher frequency of going to the toilet. This is one of the symptoms of the BAM. Now, the condition that's associated with BAM, you look at it itself, right? You can see that the blue one representing all the surgical condition, right? The green one is the one that actually have diseases that you just mentioned, like IBS, functional bowel diseases. These two are the common other diseases, digestive diseases, diarrhea diseases that we just mentioned, that is actually having a medical condition that's together associated with BAM as well. So you can see this bile acid absorption, reabsorption problem, right? It's very common and in fact widespread, concurrently occurring in many types of disease condition, including our SIBO, the bacterial overgrowth condition itself. Right, so what to do with this type of malabsorption diarrhea? Right, first of all, concentrate on the diet itself. the primary strategy is reduce your fat intake of the diet. Because your bile salt is excessive itself, and then it's not reabsorbed. So therefore, what you want to do is must restrict your fat intake. This is one of a very effective strategy itself. So if you have this condition, you can try to cut down on your fatty food intake, increase your soluble fiber, right? So Byzinium, husk, oats, bananas, cooked vegetables are good source of soluble fiber itself. And the nutritional support side, as I say, fat soluble vitamin A, D, E, K is very important because it's a case whereby you lose all your nutrients, fat soluble nutrients, and also vitamin B12. All right, now let's do a summary of these two. Because they have overlap. Bacterial overgrowth itself, right? The dietary focus is low food map, right? But if you are suffering from bile acid, malabsorption, right? The dietary focus actually is low fat. So there is a very different strategy altogether. Remember, so if you find that yourself is actually due to the bacterial overgrowth diarrhea, then you actually choose to have low fermentation food. But if you're due to the bile acid reabsorption problem, then you should cut down your fat diet itself. Right? Okay, now the problem is that both conditions can coexist, right? So I put it that way, the SIBO and BUM are common underdiagnosed cause of chronic diarrhea. Very common, very common. And this is where the complication of how to deal with diarrhea. That's why I take time to explain it, because this is a complication itself, right? So you want to distinguish them is that if you are sensitive to the food map, it means a high fermented food itself, then your cause of diarrhea is due to the bacteria, SIBO, right? But if you are sensitive to the fatty food, and you cause diarrhea, then your cause is due to the BUM, right? So therefore, this is the way for you to distinguish the type of diarrhea, depending on the food you take, which one you are more sensitive to itself, right? But very often these two coexist, as I say, right? So general practice for both itself, right? So first of all, prioritize low-fat diet. Try to cut down on your fat, if you can, and at the same time avoid highly fermented food. So these two have to go concurrently if you have both conditions exist, which makes sense, right? Okay. Now, general practice for both: keep detailed food and symptom diary. Stay well hydrated between meals. Avoid alcohol, caffeine. Manage stress, and consider small amount of ginger or peppermint tea, which is helpful for you. All right. Now, as I mentioned, all this diarrhea we have itself, probiotic actually is one of the most effective therapeutic supplement for chronic diarrhea, right? So I would do with all the detailed study, the reports you have. You can see from here the probiotic is effective in treatment of a lot of types of diarrhea, including lactose intolerance, Traveler's diarrhea, antibiotic diarrhea, and chemo-induced diarrhea, so on and so on. So therefore, it's always a standard supplementation for chronic diarrhea. This is the very important point to read. Probiotic is not effective for acute diarrhea, but probiotic probably is one of the best source of supplementation for your chronic diarrhea. Okay, now, when chronic diarrhea needs medical attention, patients with these symptoms require medical attention when you are having symptoms that wake the patient from sleep, right? You have unexplained weight loss, you have visible blood in stools, or you have a family history of celiac disease, IBD, or colorectal cancer, right? Now, if you're having these symptoms, right, this should be an alarm feature for people suffering from chronic diarrhea. So do not keep it to yourself. Go for medical advice. Okay. Now, the self-management in chronic diarrhea as a general core principle, right? Hydration is priority in all types, right? Dietary adjustment depends on cost, as you all will understand now that depending on your cost, you have to adjust your diet according to, right? So you need to understand and identify your cost, right? Reintroduce normal diet gradually. Seek professional help if you persist more than 2 weeks or with red flags. These are general self-care principles for people who suffer from chronic diarrhea. Okay, now let's go to the atomic product itself. So the first product, obviously, we're going to talk about is atomic probiotic. Atomic probiotic in this table, you see that there's two types, probiotic 10 plus and SCI, right? So 10 plus is more suitable in the case for chronic diarrhea. Basically, you will be the one that I will recommend the suffering from chronic diarrhea as a daily supplementation because you have a wider, broader spectrum of actually strain, which means application scope. And basically, you also include enzymes in the formulation. Whereas SCI microbe is actually more targeted towards specific disease condition, and you have a higher, although you have a higher, what we call CFU strength. Okay, let's look at it itself. 10 plus is actually for digestive health maintenance, indigestion, chronic diarrhea, right, as I mentioned, right, and enzema in children and gestational diabetics itself. So the chronic diarrhea, you can take 1 to 2 sachet a packet a day, right? You can even take up to 3 packet, but I think that because it's meant to be taken for long term, you don't have to actually take high dose. Yeah. Okay, now SCI, as I mentioned, are more targeted towards more specific condition. So if you have any of these associated diarrhea condition, you might choose to take SCI for a better result itself. Okay, another one is actually is that diarrhea very often the complication is resulting in nutrient loss, right? So therefore, I will here cover up those supplementation that's been helpful for people who are suffering from chronic diarrhea. So enzyme, as I say, is a very helpful supplementation for especially for people who are having lactose intolerance, so on. But enzyme itself also helps in absorption. So therefore, if you are having a malabsorption, enzyme is actually a very useful supplementation. Probiotic, we have talked about it, right? Now for malnutrition, obviously you need protein, and triple up protein is a very good source of protein and a very absorbable, easy absorbable meal replacement protein, right? Then for multivitamin itself, you can actually take it in the form of drink. Power Vital Energy is a very good multivitamin fruit drink, functional drink, right? And you can also choose to take spirulina for natural form of multivitamin supplement. Both are actually compatible and useful as a multivitamin supplementation for people who need nutritional support. Okay, so enzyme, you can see from here, I mentioned that the enzyme not only actually contain enzyme, but also contain B1, B5, and B7. So which is also important in a lot of cases of diarrhea itself, right? You can see from here the enzyme here actually is that you can see here is a full spectrum of enzyme, including lipase, lactase, right? Which we talk about lactose intolerance, right? So if you look at it itself, actually this is a very comprehensive range of enzyme, and I will always recommend that for those who have chronic diarrhea, it doesn't hurt for you to always supplement with enzyme as well in a meal. Okay, so 1 pack per day with meal, right? Malabsorption, muscle wasting, malnutrition, weight loss, underweight, bloating, and symptom associated with digestion gas. All right, you can of course take up to 3 packs per day with meal. That means 1 pack with each meal itself. You can also do that, right? But you start with 1 pack per day with meal and see how you can improve your symptoms. Okay, so this is the end of my session.